All the action packed in 180 minutes. Power Breakfast with Tessa Dooms. Weekdays 6 to 9 a.m.
The time now is 7:53. 53. You're on Power Breakfast this morning with Tessa Dooms. And we're moving on to a story now around healthcare in Gauteng. Foster Mohale, the national spokesperson for the Department of Health, joins us just to... No, I might be mistaken. Sorry. Foster, you are a national health spokesperson. Just to give us a sense of what is happening in terms of security costs in Gauteng, and particularly in our Gauteng hospitals. Why are costs seemingly ballooning? According to the DA, it seems that the costs are getting so high that they're worried that it will jeopardize patient care.
Good morning to you, Tessa, and good morning to your listeners, and thanks for this opportunity. As you correctly said that I'm speaking for National Department of Health, I may not be able to speak to specific issues in provinces, but what I can tell you and the listeners is that as the Department of Health, both national and provinces, we prioritize the safety and security of our patients, the staff, the visitors, and also the equipment. And our security efforts are informed by the crime rate at a particular area in a particular province. Of course, in some areas you will see that we spend more on security measures than other provinces. Obviously, we work closely with the law enforcement agencies. We also participate in the NAD joints, which is a coordinating body for safety and security across the country. So the areas which are categorized as hotspots, we also ensure that as government, as health sector, we deploy more security measures in those areas in response to the possible security threats, the violence and thefts and robbery against our patients, against our visitors, but also to safeguard the equipment in our facilities.
Sure. Foster, when we go as residents of Gauteng to any of the public hospitals or clinics, what we observe in terms of security is not much more than a security guard. So what are we paying for in the millions and billions when it comes to security that we may not be able to see at first glance?
Yeah, as I said, that I will try to give a general picture, not only focusing on the Gauteng, because I don't want to talk to space. Yeah, look, of course, security is like, sometimes we work like an intelligence. We cannot reveal all our measures so that people will be able to counter our measures. So that's why you will see in some other health facilities, hospitals, you will see fewer security guards, but you don't know what is happening behind the scenes. So some of our efforts, they are intelligence-driven. So we will not be able to divulge all our efforts in a public space. But we know that in terms of readiness, we are ready to counter any form of security threats.
I mean, I think one of the things that's interesting to me in this is that we're talking about state hospitals and the government, but it seems that government would be paying private security in order to keep our hospitals safe. What is the logic behind that? And is there no case to be made here for the strengthening of the police service, for example, in this instance, as opposed to shelling out, millions in terms of security companies?
Yeah, as you know that the police are deployed to perform a certain function beyond security. But what we do as the Department of Health, both national and province, we work closely with the law enforcement agencies like police, like crime watch, in order to ensure that we make our health facilities conducive, safer places for our health officials to perform their duties, and also for visitors and families to be able to feel free when they are in our facilities. So whether the issue of why can't we deploy the police or the military to our facilities and other government officials, I think that issue can be discussed at another structure. But what we do, we ensure that we collaborate with these SARS, we work with the security companies, we work with also community-based structures, because we feel that for us to ensure that our health facilities are secured, we need all hands on deck. We need the involvement of all stakeholders in the community so that our health workers, our visitors, our patients are able to work and stay in our facilities without fear of becoming victims at any time.
And when we talk about becoming victims, what kind of crimes are we generally seeing patterns of in our health facilities? What are we most concerned about?
Yeah, look, a number of criminal activities, they do happen across the country. Of course, our hospitals are not immune from these incidents like your theft, like your robberies, like your assault. But what we always ensure, that what we have not recorded much in our facilities is the theft against our equipment, because the place where we store our equipment is highly secured. So that's why we say, as much as there's high crime rate in the country, we try by all means health sector to ensure that our equipment, our facilities are secure. But we cannot say with certainty 100% that we will not experience this kind of incidents like thefts, robberies, and assaults. Hence, we say we need all hands on deck to ensure that our facilities are conducive, are safer places for people to visit to receive healthcare.
And are you at all worried about the DA's claims here that they believe that the expanding of a security budget is coming at the expense of care of patients? I know we're not going to be able to talk to the specific details in Gauteng at this point, but is that a possible risk in terms of a trade-off of security versus patient care in a time where we've seen about a 10 billion rand cut to the health budgets?
Look, it will not assist to have all the equipment, all the state-of-art infrastructure, all the health professionals in our facilities while security is not guaranteed. So we need to strike a balance between the safety and security of our health facilities together with the provision of healthcare. So we need to strike a balance. Other than that, we will not be able to do justice.
All right. Thank you so much. That's Foster Mohale speaking there for the Department of Health, the national spokesperson. The time now is 8 o'clock and it is time for the news.